Hi everyone, and welcome to the new phase of our class. So we spent the first weeks building a strong foundation in diabetes education. Today we're not leaving diabetes behind, but we're zooming out to see a bigger picture called metabolic health. This includes your blood sugar, your blood pressure, your cholesterol, your weight, the liver, muscles, sleep, stress, and daily habits. So it's a big category. We're gonna talk about more further in these classes. So today's goal is not to overwhelm you with every topic at once. We're starting with the big picture. Think of this as level 2 of our health camp. We're going to learn how the body works together and how small habits can help several areas at once. Okay? So metabolic health, it is how your body uses and stores energy. It includes diabetes, blood pressure, cholesterol, fatty liver, weight around your waist, overlap of weight. Does anybody ever been told they had a fatty liver? You did? And what did the doctor tell you to do for that? Nothing? So eating healthier and making better choices, we're going to learn about that. We're going to learn about what can help with your fatty liver. Okay?
Losing weight seems to help a lot.
Absolutely. And changing your diet too. Small habits can improve more than one number at a time. So it's not, you doing good with one thing is going to improve your diabetes, it's going to improve your blood pressure, it could improve your weight. It's going to be overlapping these numbers, okay? So this series is going to be broken into small, we're going to call them practical missions, okay? So connecting back to the previous classes, you guys have learned about the A1Cs. We learned about highs and low blood sugars. We learned about sick days. We learned about all the complications that can come with diabetes. We learned how to read nutritional labels. We talked about how to plan meals, and then you guys have some plates so you can plan meals now. And we talked about how stress and sleep can also affect our blood sugar. Now we're going to use all this knowledge to understand the whole bigger picture. This helps patients that have diabetes or pre-diabetes, or maybe just high blood pressure, cholesterol issues, or just anyone that wants to prevent a problem. Wait, did we talk about everything? Okay. Yeah, so like we said, blood sugar is important, but it's not the only health number we want to be concerned about. There's other risk factors we talked about. Many diabetes risk factors also can affect the heart, the kidney, the liver, and circulatory. And like we said, the same habits that help the glucose can also help your blood pressure or your cholesterol or even give you more energy. The series is about prevention, confidence, and just making routines that you guys can stick to. Because let's face it, if you're not going to be able to stick to it, then what's the point of making it, right? Someone's coming. Okay. So hi, welcome. What does metabolism mean, right? People often use the word metabolism to mean weight or calories, but it's much bigger than that. It is how the body handles energy. Two people can weigh the same, but have very different blood pressures, cholesterol readings, or even liver health. That's why today's focus is not just weight, it's health patterns. We're going to talk about health patterns. Hi. So, what does it mean? It is how your body turns food into energy and how we can use it. Metabolism also includes how to use glucose, fats, and stored energy. It is affected by muscles, if you have weak muscles, sleep, stress, hormones, medications, and daily activities. So all these things you can influence to change your metabolism. A healthy metabolism is not just about being thin, okay? So I know that a lot of times people think that, but it's not. So today we're making the transition from talking specifically about diabetes into looking to the bigger picture. Think about metabolic syndrome as a warning light in your car's dashboard. One warning light itself may not seem like a big deal, right? But when you have multiple lights coming on at several times, it's telling you that something bigger is going on. So metabolic syndrome is not just one disease. It's simply a group of health conditions that tend to occur together. The main 5 things that we look at, that the doctors will look at, is your blood sugar, your blood pressure, triglycerides, and your HDL, which we also known as your good cholesterol. They'll look at your waist size, because if you have excess fat around the abdomen, it is linked to insulin resistance. When several of these are outside of the healthy range, it tells us the body is becoming less metabolically healthy. So the good news is these numbers are all connected. That means if you improve one habit, you're likely going to improve more habits. So let's take an example. So like, say you become more active, start eating more fiber, sleeping better, making sure you're getting enough sleep at night, and even losing a little bit of weight. It's gonna improve multiple numbers at once. It could make your blood pressure go down, it could make your cholesterol numbers improve, and it's definitely gonna make your blood sugar improve. So it's not that we have to have a whole bunch of different patterns, we just have to stick to one routine. And I don't want anyone to think here leaving that they have metabolic syndrome. That's not the purpose of the class today. The purpose of the class is to just use it as a tool to understand how all these numbers can work together. Over the next several months in my classes, we're gonna learn how to make small, realistic lifestyle changes that can improve these risk factors. So our goal isn't perfection, remember? It's progress. So when you go to your doctor's appointment, which number do you normally pay the most attention to? Anybody? Which number are you most concerned about when you go to your doctors and you're going to review? Cholesterol? Okay. What about you, Bob? What are you most worried about when you go to see the doctor?
Until recently, my weight. Your
weight? Okay. Yeah, so most people focus on one number, but now we're going to start looking at multiple numbers. So we're going to ask the doctor, what are all my numbers? What's going on with this? And see what he says, okay? Metabolic syndrome is also linked to a higher risk for type 2 diabetes, heart disease, and stroke. The provider has to diagnose you with this condition using a medical history, an exam, and lab results. So these are the main 5 clues that we all look for when we're talking about metabolic syndrome. A high glucose or A1C, high blood pressure, high triglycerides, a low HDL. So the low HDL, that's your good cholesterol. We want that one higher, the better, okay? And then we also have the large waist size, which is more belly fat around the organs, okay? So those are all 5 clues that can lead to metabolic syndrome that we want to watch and keep an eye out for. A lot happens before someone gets diabetes diagnosis. Insulin resistance, does everyone kind of know what insulin resistance is? Sort of, okay. So it basically means that the body has a harder time using the insulin efficiently. So the pancreas can compensate by making more insulin, and over time, the blood sugar is going to rise, and then that insulin is not going to be able to bring the blood sugar down. This is why movement is so important, right? Moving, getting your muscles moving, getting good food quality, making sure that the food that you're eating is a good quality, not processed, over-processed. We want to stick to limited ingredients, very natural, not processed foods. And then making sure you're getting enough sleep. We always talked about sleep being very important, but sleep is very important. You need to get enough sleep. It's how your body is repairing itself. And stress. We need to learn how to control the stress. If we learn to control the stress, then we can bring the blood pressure down, we can bring the blood sugar down, and we can just feel better, general. Okay, let's see. Improving these habits early can help lower your risk. So that's why we're talking about it now, because it's never too late to start. So the health, it works like a web, right? So the main message is they're not separate boxes, everything's connected. So say like one habit, like walking after dinner. That can also help your blood sugar. It could also help your blood pressure. It could help stress. It could help you sleep because you're more tired from walking. And it can help you lose weight over time. So all of these things, one thing you can do can help with multiple things. You don't need 10 different plans. You just need one consistent habit. So like these are some more examples over here. Eating more fiber and adding more color to your diet, that's gonna help your cholesterol, that's gonna help with your weight, that's gonna help with your liver and your blood sugar. Eating protein with meals, that's gonna help with pretty much everything. Regular movement, same thing. Less smoking and sugary drinks, all those things are gonna help everything. So if you can pick one of those to work on and zone in on, I would like you guys to do that. Okay, so now we're going to do a little activity. Yes?
Better sleep, rule out sleep aids.
Sleep aids, I mean, if you're getting the sleep with it, do you have a good sleep hygiene? Like, do you turn off, you don't watch any electronics after a certain time? Quiet, dark, cool room?
I watch television, usually some kind of sports until 11:30.
Yeah, and then, so it's always recommended, maybe to give yourself an hour rest before going to bed. Turn off all electronics, all blue lights, help you sleep better. And making sure your room's nice and cool, making sure you're very comfortable, those types of things always help you sleep better. But if you're getting some kind of rest with your sleep aids, then that's good, as long as you're not too much dependent on them. Okay, let's see.
I can watch TV to get my mind to stop thinking.
Yeah.
But I have it very low, and then it automatically shuts off in a half hour.
Well, that's good.
Is that okay?
Yeah, I mean, if you're not, are you having trouble sleeping?
I normally do not, but I keep thinking about stuff.
Okay, so Dr. Mahajan made a really good point about this at one of his other classes. He said, pick a worry time. Pick a time during the day where you're gonna worry about stuff. And that's the only time you're allowed to worry about it. So that way, say it's like 5 o'clock. Okay, I'm gonna worry about everything at 5 o'clock. You worry, do all whatever. And then when you go to bed, you've already worried about it. So it's not on your mind. Give it a try.
How do you shut that off?
I don't know.
I did.
Give it a try.
No, I'm sorry.
Even when I was working, files were chasing me.
Okay, I gave you these already. Okay.
I already have.
So these are just like a private thing. We're not grading you on this. I just kind of want you guys to go through and talk to and look at it yourself and see what you already do and what you can improve on, okay? The purpose is to notice a pattern. I want you to see the strengths that you also have, and then I want you to see what you have to improve on, okay? And then for everyone at home, I think I put a scorecard up. If you're watching my YouTube channel later, this is what they're doing right now. So everyone take a minute and just look at this and fill it out for me, okay? You need a pen? You need help?
I was looking for a pen.
I got two. You're done. Okay, let's see.
I don't use oats or I'm just
that's
beginning
okay.
to get back into rice.
Okay, that's fine, that's fine.
But everything else I'm doing.
Good, looks like you're doing pretty good, yeah.
I'm still stuck on a plateau as far as losing weight's concerned.
Mm-hmm. Do you walk?
I yoga.
Okay, try walking after your meal.
Yeah.
Maybe just even like a little 15-minute walk. Helps get everything moving.
You know how hot it is outside?
I know. Try do it, maybe do it first thing in the morning then.
We'll walk to the hall
Oh.
Yeah.
because it's too hot outside.
Mm-hmm. Or first thing in the morning or later in the night, yeah.
Or a grocery store.
Yeah, there you go.
Gym.
The gym.
Or the gym.
Yeah. Walk inside somewhere, that's a good idea. Mm-hmm. Good. Good, what do you think? Do you do some of this stuff already?
Yeah, I got a few.
Some of them, yeah.
Not too many.
So you want to work on, okay, guys, that's okay.
Yeah, that one.
Do you know what it is?
It was 7.8, I
Mm-hmm.
think, which is actually down considerably. The machine went to 14 and I pegged it
Oh, okay.
2 years ago,
Mm-hmm.
but it's never been any lower than 7. He said he wants it at 5.
Okay, well, we can still work on it. We're do you walk after? So that's
No.
something you want to work on. So there's a couple of things that you can work on too. You can pick, like, you don't have to overwhelm yourself, you know. Pick one or two and try
I haven't
it.
slept in 20 years.
You have trouble falling asleep or staying
Yeah,
asleep?
I can't sleep at all.
Mm.
Maybe an hour,
Mm.
hour and a half.
Okay.
I drove a tractor trailer on the over the road
Mm-hmm.
in a teeny situation, and you're in the back attempting to sleep while some other fool is driving.
Mm-hmm.
It doesn't work.
Wow. Okay.
Yeah, it messes me up.
You good?
Is my cholesterol level at goal?
I'll have to check for you. Good. Very good.
Can I check that?
Yeah, I'm sure it is.
Okay.
Let's see. And then, good. All right. Okay, so does anybody want to elaborate on anything? Did they notice any patterns? How are you guys doing on these? Did you guys do pretty well? You did pretty well, huh? Yeah, so you do a lot of stuff already. There's a couple things you're going to add. Okay.
Change and start eating brown rice and quinoa.
That's wonderful. I like that. That's a great idea. Stay away from the white rice.
Yeah.
Mm-hmm. Good.
The problem is trying to lose weight when you're eating carbs.
Yeah. So remember when we talked about no naked carbs, eating the carbs with a protein or a fat? That will definitely help. Mm-hmm. Help slow the absorption of it.
Meals and the vegetables I get to do a little rice in the bottom, I guess.
Mm-hmm. Just a little rice and then you have lots of vegetables.
Yeah.
Mm-hmm.
And then
A little bit of protein.
yeah, beans, cheese.
Yeah.
Yeah.
Good. Very good. Okay. Are we good? You want to move on? Okay. So did anybody find one area hard? Like maybe movement's a little bit hard for some people. Getting up and walking around, moving around. So maybe that's something that you guys can focus on. You know, at the bottom there's a little line for you to write, my one area of focus this week. I like you guys to pick something and try to stick to it. Something realistic that you guys think you can actually do, okay? And then we'll talk about that at next class. So we're going to talk about what we can influence. So sometimes you can feel defeated because diabetes or heart disease or even high blood pressure run in your family. Genetics do matter, but they're not the whole story. What can we influence today? Well, this is where the camp's going to come in at. So we already know we cannot change your age, your genetic, or your family history. But what we can influence is adding small things in, like we were talking about. Maybe going for a walk after, well, it's a little bit hot now, so maybe going for a walk in the morning or maybe in the later evening, or walking around your apartment complex, or going to the gym, or walking around the mall. Those are all really good options to just get some movement. Food choices. We talked about making better food choices, no naked carbs, you know. You guys can have carbs, but just don't eat them alone. We have to have a balanced meal. We talked about sleeping better, and I'm going to get you some better sleep stuff too. I'm going to give you a pamphlet later for help you with sleep. Talking about sleep routine, sleep hygiene, and how important good sleep is. Also talking about hydration. We did the hydration at last class. You missed? Okay, yeah, but yeah, we did a little demonstration where we made our own little hydration with maple syrup and lemon and a little bit of salt.
I'd love the paper on that.
Okay, yeah, I think I have one. So yeah, that was really great. Hydration is really important for keeping us strong and everything. And we talked about not smoking. If you are smoking, talking about how you can quit. If you need help, you know, we have Florida Quit here. There's lots of options. And also just taking your medications consistently, you know. That's what the doctor prescribes them for. So make sure you're consistent with taking them, okay? Those are all things that we can influence and that can also make a difference. So So this is not going to be a full nutrition class today. This is just going to be a little foundation. So we talked about protein, fiber, and color. Those are 3 easy words that you guys can remember, right? Instead of saying, what should I cut out? Why don't you guys ask, what can I add to make this more balanced? Okay, so, maybe I can add some protein. Do I have any fiber in this plate? If not, let me add that. And if you're gonna get fiber, color. That's why I have the rainbow of vegetables today. That is a fiber, colorful rainbow for us. It has lots of vitamins and minerals, and it's just colorful plants. Add those to our diet. So you wanna add some more color into your diet. That's a main thing too. And what else? We can build, we're gonna build on this in future sessions too. We'll go into it in more detail. But if you guys can do that, think of that. Remember those 3 things: protein, fiber, and color. So movement, it doesn't have to mean the gym. It can mean the gym, but it doesn't have to mean it. It can be just walking. It can be doing some chair exercises. It can be just doing sit to stand, very simple stuff. Resistance bands, anything counts. This is all stuff that's gonna help with your balance, gonna help with your movement, gonna help with your muscles, gonna help with your blood sugars, gonna keep you from falling, keep you more independent for longer. And we're gonna I'm gonna go into more class, and we're gonna do, it's called Muscle is Medicine. And we're gonna do some exercises, and I'm gonna do Tai Chi walking. I'm gonna do an introduction into that. Tai Chi walking, okay? That'll be in some future classes. So again, let's talk about the stress and the hydration, because that definitely counts too. If you're exhausted or you're stressed or you're dehydrated, just not feeling well, healthier choices are harder to make. I know that. And we don't feel good. We want something quick that we can just, whip together. But this is where we have to stop and think. We have to make sure that we're using these realistic tools that I'm teaching you to keep our balanced meals and keep our healthy habits, such as breathing when we're stressed, deep breathing exercises, because we already know that when we're stressed, it raises the hormones in our blood and makes our blood sugar rise. So we already know that. So we have to work on that, how we can bring our stress down. Sleeping better, that's another big thing. I know I keep talking about that, but it's so important. And I'm gonna help you guys get a better sleep habits. And then hydration, staying hydrated. When you're a little bit older too, if you get dehydrated, you can go down really quick. So it's very important to stay on top of it, especially in the heat in Florida, if you're outside. And sometimes water just isn't enough. You need a little bit of salt and a little bit of electrolytes too, okay? And then just, the meals don't have to be complicated. Just simple meals, less ingredients, but balanced. So let me talk about today's snack, right? So it matches our whole metabolic health panel because it focuses on color, fiber, hydration, and protein. The dip that we used, it was a Greek yogurt dip. It was with ranch, but see, the point was it had protein in it. So it's not just like sour cream that's just giving you a fat, it's protein. So it's going to give you some energy, help your muscles, do more for you. And if you can't tolerate dairy, then you can always try hummus. Hummus is another great option to do with your veggies.
Okay, so what protein did you add to it?
It was a Greek yogurt.
Oh, the Greek.
So the Greek yogurt has the protein in it. You could do cottage cheese too. I was thinking about that too, because cottage cheese has it. You can blend it to make it real smooth and then use that too if you're not a real fan of that tangy yogurt taste. You know what I mean? That's another good option.
You can also blend cucumber in it, and it takes that tangy.
Oh, there you go. Okay, good. Thank you for sharing that. And then let's talk about the dessert, okay? So I know some people didn't like them, but you have to remember that there's no processed sugar in it. There's no added sugar at all. The only thing that we used in here was a banana and a tablespoon of date syrup. I don't know if anyone knows what dates are. Does anyone? Yeah, so they're pretty sweet, and they have a syrup now that's a little bit better than maple syrup, a little bit less, and it just gives a little bit of a different, sweeter taste to it than the maple syrup. So that's what I used in that, and the banana is what makes it sweet too. But like we said, remember that they're not perfect, they're just better. So we still have to watch moderation because the banana still has sugar. You know what I mean? So it still can raise your blood sugar. So portion size matters. We did use an almond flour, which is going to reduce your refined flours, and it's going to add like a little bit of texture to it. The peanut butter gives you fat and some protein. So I just try to keep it real simple and clean. You know, sometimes you have to just get used to it, you know, when your body's so used to that sweet sugar. So, but these are all just meant to help us get a craving that we're having so we can not reach for the sugary stuff, but reach for something a little healthier. Okay, so your 2-week challenge, I do want you to try to pick 1 or 2 of these. We don't have to change every day, but maybe like try it a couple times a week until you can build up to it. Something realistic that I think that you will stick to. So maybe you want to add a color to your meal every day. You add some more green or something. Maybe you're going to take a walk, 5 to 10 minute walk. Maybe you're going to eat more, make sure your snack's a more balanced snack. Or maybe you just want to write down a question to talk to your provider about, you know? Okay, so now that we learned about a lot of stuff, I want to play a little game. It's called Fact or Myth. Hey Greg, we're gonna play a little game, okay?
Okay.
Fact or myth. So I'm gonna say something, and then you guys are gonna hold up either the red card or the blue card. If we're gonna hold up the red card, that means it's a myth, okay? The blue card is gonna be a fact, okay? Here we go. Losing weight, 5 to 10% of your body weight can improve your health. What does everyone think? Blue or red, fact or myth? I'm seeing lots of facts. Very good, yes. It is a fact, yes. Second one, you have to be overweight to have metabolic syndrome. It is, it's a myth. You do not have to be overweight. That's correct. Walking 10 to 15 minutes after meals can help lower your blood sugar. Fact? There we go. Yep, that's definitely a fact. You have to join the gym to improve your health. Myth. I like that. Very good. You guys are smart. Poor sleep can affect your blood sugar and your blood pressure.
Oh, wait a minute.
Fact. Very good. Yes, it can. Drinking water is important to your metabolic health. Fact. Very good. Yes. Skipping meals is a healthy way to speed up your metabolism. Very good. That's a myth. That is a big myth too. I used to hear that. That does not work. What does that do? Does anyone?
It actually sits on the weight.
Yeah, and then what? It makes you have cravings.
Right, your body's storing it.
And then later on you're going to have cravings because you skipped that meal, and then you're going to overeat.
It makes your body go into that starvation, that, oh my gosh, I'm not going to eat again.
Yep.
So it stores it.
So it's not good. So eating smaller, balanced meals is a much better option. Stress can raise your blood sugar.
Of course.
Fact. Very good. You guys got that. All carbohydrates are bad for you. They're not all bad for you.
That's not what I was told for 10 years.
So fruits are still carbohydrates.
Those
Fruit's a carbohydrate.
Fruits?
Fruit is a carbohydrate because it's a
I
sugar.
was also told fruits
Well,
are-
moderation. Yes, vegetables are a much better choice, but you can't just live on vegetables if you want some joy in your life too. You know, you can add a little bit of fruit in, but you just don't have to.
Cake.
No cake. I didn't say cake. That carbohydrate's bad for you. Strength training can help improve my metabolism. Very good. Yes, it can. High blood pressure is part of metabolic health. High blood pressure. High blood pressure. Is it part of metabolic health?
What do you mean? You mean
Is it part of the high blood pressure is part of metabolic health? It is. Yes, it is part of it. Remember we were talking about that? It's one of the factors that can affect it.
Lower health.
High blood pressure is part of metabolic health.
Oh,
Health.
The word health is confusing. 'cause
Oh.
yeah.
Okay.
The word high is confusing. Blood pressure
Okay.
is important
the
to
high
metabolic
blood
health.
pressure is not.
So high blood pressure, remember if your blood pressure is high, you have a higher risk of getting metabolic syndrome or
Right.
yes. So it is part of it. The question's kind of worded a little weird. Sorry about that. Diabetes is the only condition related to the metabolic health. True, we just talked about that, right? Very good. Small healthy habits can make a big difference over time. Fact, very good. Eating healthy means you can never enjoy dessert. Yes, we know that. We try this with the dessert makeover, right? We're trying to eat healthier desserts.
Yeah.
Very good. Yes, and even, you know, like we said before, if you were at a friend's house and you guys were having a party and you needed a little piece of cake is okay. Just don't eat a huge slice, you know what I mean? But then just remember, I ate that cake today, so I need to do something extra to walk that off. Maybe go for an extra walk or do something extra because you had that cake, you know? So you don't have to completely cut it out. Just make sure that she's saying no. She said, no, Greg, not for you.
You're detox.
Okay, it's okay to improve one habit at a time instead of trying to change everything at once. Very good. Okay, so last question. It's going to be a multiple choice. Which one of these is not part of metabolic health? Is it blood pressure, cholesterol, sleep, or hair color?
Take a
Hair color, right. Because it's not about what you look like, right? It's influenced by your blood sugar, your blood pressure, your cholesterol, your movements.
hair color, you don't eat it.
No, you don't. Okay, very good. That was great, guys. Thank you. Okay. All right, so let's see what this was. Okay, so this is what's going to be happening with the series where we're going with this. Next, we're going to talk about insulin resistance and why the body has to work harder and what we can do to help that, you know, if you already have insulin resistance, and also help to prevent getting insulin resistance. Then we're going to talk about muscle as medicine. We're going to talk about walking, strength, and balance. That's where Tai Chi walking is going to come in, so I hope you guys can make those classes. And then later on, we're going to talk about our heart health. We'll do a liver health session, talk about inflammation, gut health.
And then talk about healthy kitchen.
Yeah, healthy kitchen, how to build a healthy kitchen. Yep. How to manage the stress and sleep. Each class is just going to include one practical action step, you know, that you guys can do so we don't overwhelm you. Okay. So just remember that it's not just one number. It's a multiple of numbers. And it's the pattern of how your body's doing over well. Better habits can improve several numbers at once. And progress counts, even if it's small. You know, don't get discouraged. Okay, let's see. I got another pamphlet for you guys. This was just about today's class. And then this, oh yeah, I want to tell you guys, this is our YouTube channel. If you guys want to snap a picture of that, all of our other classes were on there. We also have some exercise videos. I think chair yoga's on there. So it's great. That's our address right there. I gave you one, Sherry. There you go. You're welcome. There you go.
That's the address on it?
Yeah, this is our YouTube channel.
Where do I leave them?
Does anybody have any questions?
I have a question regarding artificial sweeteners,
Okay.
because I use monk fruit a lot.
Monk fruit extract's actually one of the better ones.
Okay.
Hmm.
Curious,
Do you,
because
which,
I like honey a lot.
I know,
Yeah,
I know.
yeah. So that's why I swapped to monk fruit.
Did you ever try date syrup?
I've never tried that.
I found mine at Sprouts in the date syrup.
Dates.
Dates, yeah. And it's like a dark syrup. It's pretty good. I like that too. And it's less sugar than maple syrup and honey.
It doesn't cause blood spine.
Now it still will a little bit, you know, but you have to remember, but it's still just a little bit healthier than honey. It's less sugar than honey.
So if he's detoxed, that's
Probably not.
Thank you.
We want to
I'm trying
avoid
keep
we
it
want to
down.
avoid all sweeteners or any added sugars for him at all. Yeah, that's still an added sugar. It's a healthier added sugar, but it's still an added
I'd
sugar.
rather him eat a banana, which I mean, you know.
If you're gonna give him a banana with a peanut butter. You know what I mean?
Exactly.
Something with protein. Something that's going to.
I like peanut butter.
I know
You like
do.
peanut butter? Peanut butter is good. Eat some peanut butter and celery.
Apples with peanut butter are great.
Yeah.
Well, there you go, Greg. I like that peanut butter.
What?
Celery. We don't have any celery.
With glass.
We
I made it in one class. I did peanut butter on the celery, and then we did little bits of granola on it.
Oh, with what?
Granola.
Right now.
Is granola okay?
There is one brand. It's called. It does have a little bit of alcohol sugar in it, but it's only 4 grams.
We're not doing that. We're
Yeah,
trying
maybe
to-
later on down the road.
Yeah.
Yeah,
we're-
but still, what about raisins?
We're once you open a door,
Hmm.
we're detoxing that door.
Wow, you're strict. She's strict, Greg.
Well, honey, it's that or going to nursing home.
Yeah. Okay.
He loses his legs
That's
and he's in
good.
a nursing home.
That's
We're trying
good.
to keep his legs. We're trying to keep his legs.